This is the lecture on conflict management and identifying the trainee in difficulty. Of course, this is an important topic, so I would like to thank the postgraduate team from our department for organizing this, and also there are a few references that I took to prepare this talk. Special thanks to Ms. Pung Hudi, the consultant urologist in Hospital Kuala Lumpur, for providing some slides on identifying candidate in difficulty, and also I took some references from the Royal College of Physicians and Surgeons of Canada. Well, conflicts, the myth. Okay, it's important for us to know some myth. That conflict can be avoided. Yep. Conflict is bad. Yep. Conflict is impossible to resolve. Yep. We need a lawyer. Yep. All disagreement escalate into conflict. Yep. Yeah. Most of these are not exactly true. Yep. Well, conflict is in daily life. You want to achieve something meaningful. Yeah, conflict is almost always inevitable, but combat is optional. Yeah, we should avoid a fight. Yeah, we should find a solution together. Well, there are many different scenarios. Yeah, that could lead to conflict. Yep. So it could be physicians, trainee, like in our talk today, and conflict with other health care provider, and conflict with patient, which is probably another topic by itself. Well, the first step, towards managing conflict is to accept that this is something normal. It happens, yeah. And then we must identify the source of conflict. Yeah, why do these problems come about? And then we should work together. Yeah, all parties should be working together, to find a solution. Yeah. Factors that creates conflict could be due to past history, relationship between the different parties, the structural, emotional issue, the different needs of different people, and the breakdown in communication. Well, as we all know, yeah, communication is the tool. It's the skill that we always learn, yeah, as we grow. Yeah. Then the effective communication should proceed in the following manner. All right, we should listen fully. Yeah, we know that, but sometimes we can't control ourselves. Yeah. Then we must listen and see what's the important issue that the speaker want to highlight to us, and we could check with them, the person who complain or want to raise the issue, by asking specific questions to ask them to clarify. And we must pause and think, yeah, or we must at least look as if we are pausing and listening. And then then only we will try to clarify the question, and then only we can respond to the patient or to the person who make the complaint, or who is unhappy, yeah, with the situation. That is the last step. Listen first, digest it, clarify, then we respond. Well, there are role of emotion in all conflict. We know about that. The people get angry off and on. We just need to mitigate that. Yeah. And then we must understand and recognize individual conflict. Yeah, there are different styles. There are different styles of managing conflict, and I would like to introduce this term here: Thomas Kilmann conflict model instrument. Yeah, if you can remember that, that will be fine. There's TKI, it's called Thomas Kilmann instrument. It's a tool to measure conflict. Well, it apparently is quite famous. If you Google conflict, and this term will always come up top in the search. These two person, Rafe Kilman from the University of Pittsburgh and Kenneth Thomas from UCLA has come out with this model to handle and assess conflict. They are the expert of conflict. So they come up with different styles. They have described about 5 styles of people, of different way that people deal with conflict. So it's good to know. Number 1, competing style. I'm sure you have seen people who deal with conflict in that style. My way or the highway. Okay. So these are aggressive approach. Of course, there are drawback. You create an environment of fear, and over time you will create an environment that you are all surrounded by yes men, which is not good. Then the second style is the avoiding style. Well, it's quite understandable from the description. It's the head in the sand approach here. Okay, so not assertive at all. It's unlikely to satisfy anyone's concern. But however, sometimes it can be used when things are of low importance, and you want to buy time to see how to resolve the problem and to control a very agitated situation. Maybe that could be used temporarily. Then this compromising style, we say just split the difference. Just cut to half and get it settled with. Not ideal as well, but of course it could be used in a certain situation when the stake is low, the issue is of low importance, and so on. Then the fourth style described is the accommodating style. Well, whatever you want, just accommodate to whatever need that people want. Of course, this is not ideal as well. Well, this is the fifth style, described by the Thomas and Kilman model. This is actually the preferred style. Do remember the term. Collaborating style. Well, the key point is that people sit together, and just say, let's work it out together. It needs effort, it needs time, and it needs some intelligence. So it's highly assertive, highly cooperative, and at the end, if enough effort is put inside, it satisfies all party equally. And when this, it should be used, well, the description is you use it as often as possible. And this is the preferred method of conflict resolution. So remember this, collaborating style. So there's a chart, from the Thomas Kilman model based on the different degree of assertiveness and cooperative, whether they are high or low. So this is a diagram. The top right corner is the preferred style of collaboration, where there's high level of cooperativeness and also high level of assertiveness. So this is a picture, to describe the same concept. Collaborating, working together to get the solution. So which style is better? Like we have mentioned before, collaborative style, focus on interest and the need, that lie beneath the conflict, for both party or multiple party. So work towards the solution. Well, in many of these conflict management websites, they also recommend this book. Apparently quite a famous book. They always say, always there's this heading saying international bestseller, getting to yes, negotiating agreement without giving in. Often quoted book to study on conflict management. So strategy to increase individual conflict management competence. Yeah, we need to learn. Yeah, you and me. Yeah, we always learn as we grow. And then we should improve on communication skill, and then recognize different communication style, and then maybe adopt an avid approach. Yeah, assume things is positive. Yeah, not everybody is there to harm us. Yeah, validate the unknown, ignore the unchangeable, do something productive. And then for conflict resolution, we must identify the party who are involved, identify the main issue, find the origin of the problem, and find the solution. And remember, yeah, collaborative style of conflict resolution. So you get the solution. Yep. Then on the topic of identifying trainee in difficulty, well, this is the problem that we face. Yep, every day. Yep, it's like saving Private Ryan. Well, we must know the warning sign. Some of us are not so sensitive to the warning sign, which is very glaring and obvious to those who are trained or well versed in doing that. So it's good for us to know a few signs. Well, 7 warning sign, important one, disappearing act. we do have people like that. Low work rate. Ward rage. It's quite common, right? We hear certain Dr. X and X scolding people. Rigidity. Bypass syndrome. Don't follow the change of communication or command. Career problem. Difficulty with the exam and so on. Insight failure, that's the one that is difficult to deal with. So these are important signs. It's not in the Norman Browns that we use. Those are for clinical sign. So this is the sign for a candidate in difficulty. All right, how do we deal with that? We should decide on the main issue, find out the main issue, whether the issue is in the knowledge, or technical skill, clinical reasoning, or the attitude. So must rule out extenuating factors, whether they have a problem with fatigue, family problem, financial problem, and so on. Then there's time to reflect and conclude. So we must find out all the potential factor and to classify them. What are the main factor is there in this candidate in difficulty, and see how serious they are. And then when it's time to talk to them and find the get some feedback, should be done in a private the setting. We know about that, and should be done as soon as possible. Don't drag it too long. Solve it when the problems comes. Otherwise nobody can remember what happened. And then be prepared for negative reaction. Not everybody is happy when we give some comment or with some criticism, ourselves as well. So it's important to be prepared. And then also depending on the underlying cause and the severity, we should tailor each consultation and each resolution meeting, based on the cause and the severity. If it is the knowledge problem, we should find a way to solve it, for example. And then if it is a problem related to technical skill, so it must be tailored individually, not being described here, the cookie cutter approach. Everybody is the same, just photocopy them. It should not be done. Everyone is unique. So if there's a problem with clinical reasoning or decision making skill, so we need to have a creative approach to address that as well as described in this slide. And also based on the specific course or master program they are in, yeah, as to how to improve on the clinical reasoning and decision making skill, which is important. Yeah. And then attitude and insight, well, this is the most difficult to resolve, yeah, but the few line type here is important, yeah. Do pay attention. Obtain multiple source of feedback, that's important, right? Involve your colleague, that's important, because if the negative feedback about attitude is come from one person, well, the person who receives the command, the criticism might think you are picking them, picking on them, so if it come from one person, if this criticism, and observation come from many parties, it's like a 360 assessment, then it will be more convincing. It's more easier, to convince the person involved to change positively. So in summary, our duty is to the patients, and also to their safety. So it's important that we train our trainee well. Yep. And then we should have early remedial action. Yep. Before the problem snowball into something uncontrollable. Yep. And we should learn to recognize early warning sign. Yep. And when faced with the trigger event, we should assess the problem and then provide feedback and so on. So it's important skill that we as a trainer should acquire. Yep. So identifying a candidate in difficulty is probably more difficult than the COVID PCR test. Yeah. But of course, our role is to flatten the curve. Yep. Don't let the problem escalate to an uncontrollable level. But of course, looking at the slide, social distancing is probably not something we should do in terms of dealing with the problem. Yep. Lastly, there's a famous saying, never let a good crisis go to waste. Whenever we face a conflict, whenever we face a candidate in difficulty, there's always a chance for us to improve the situation, and we will come up better in handling those conflict and difficult situations. Thank you very much, and I hope all of us can grow to that together in the time of different conflicts. Thank you.